Good morning, ladies and gentlemen. I'm the most unqualified person in this auditorium to be speaking about health. I'm not a medical doctor. I have never worked in the health department of either the state government or the central government or been associated with any hospitals. So my point of view would be of a layman. But let me also tell you, possibly a couple of times when I was very keenly interested in health, and I think put on the papers, just listen to this, what we did. When I was the district collector of Kottayam, we achieved a quality of health index better than the United States of America, as good as the European Union. I was the district collector there for 4 years, and I won the best collector award for 4 years. I don't want to speak at length about how we did it. It was with the complete involvement of the medical community, with the panchayat president, municipalities. It was a completely people-driven movement. You would say Kerala is already very high in health indicators. But let me tell you, what Kottayam has achieved, Kerala will not achieve in the next 50 years. And what Kerala has achieved, India will not achieve in the next 50 years. So now you can imagine how Kottayam is. And as per the Niti Aayog latest evaluation published last year, Kottayam district is the only zero poverty district in the country. The only zero poverty district in the country. Couple of things which led to this. When I was the district collector, we made Kottayam town the first 100% literate town in the country in 1989. First literate. A lot of these things which happen later are a fallout of the literacy movement. When somebody is literate, they know what is good for them and what's good for their family. So it's just not the ability to read and write and just arrive at that figure. I think it's got the kind of impact it has on everything else is been amazing. I also did something strange, which again is possibly unique, because I was a chairman of the Medical College, Kottayam Medical College as district collector for 4 years. We built a cancer hospital in Kottayam because there was no cancer hospital anywhere in the southern Kerala except the regional cancer center in Trivandrum. There was no other cancer facility. We decided to build a cancer hospital in Kottayam Medical College. We built it in 1 year. And now the interesting part is, guess how many people contributed towards construction of this cancer center? 8.2 million people. I think it's the institution built with the largest number of contributors anywhere in the world. Now, for all these details, I have no time because now we have all the best experts in the country who are going to speak on patient-centric healthcare. How are we going to do it? Read my book. My book is going to be out. I finished my next book, which is titled 52 Ideas for 52 Weeks. So all these ideas are in that book. Book will be out in a couple of months. Read it. You will find very interesting stuff on how we did it. All this is possible. Now, I'm extremely happy that my dear friend Rajan Gupta and his team is organizing this. And this conference for a change is very people-centric, patient-centric. When I walked in here, I didn't find the most famous doctors, like all these are very, very famous doctors, but I found a whole lot of patients sitting here. People who couldn't move, who couldn't walk, and who are patients for lives and came forward to really change the world, and people who are unemployed. I think this exactly, Rajan, is what is required. In fact, in my chapter in my book, there is a chapter on Reggie and Lata. I don't know, you must have heard about this doctor couple who work in Tamil Nadu among the tribals, and incredible kind of people. In my earlier book, Making a Difference, which was published, which was my autobiography, which was published when I was 42, and I was commissioner at DDA, just staying across this place in City Fort Orid, in City Asiad Village. I talked about two doctors, in fact, Dr. Seth, who set up the Vernu Eye Institute. And in fact, I helped them to set up the institute. I gave them the land when I was commissioner DDA. I'm on the board of one of my institute. I also wrote about Dr. Sudarshan, who was working among tribals in the hills of Karnataka, most probably, yes. I'm not in touch with them anymore. This was in 96. So I've been concerned deeply about healthcare, and let me tell you, doctors, with all apologies, I've told my wife, if I ever fall sick, and I'm a diabetic, I'm a jogger, I've been jogging for 40 years, but I just took an X-ray and an MRI, I found I can't jog anymore because my knee's been damaged. And I told my wife and my children, if I ever fall sick, please take me to Kerala. Do not take me to a Delhi hospital. I'll tell you the reason why. The best gastroenterologist in the country is Dr. Philip Augustin. Dr. Sarin possibly is in the same league. They were classmates in names. You know how much is his consultation charge? The best gastroenterologist in the country with a fantastic center in Cochin called the Rajagiri. You know how much is his consultation charge? 500 rupees. He doesn't pull out his prescription pad and write out prescription and let you go. No, he talks to you for a good 15-20 minutes. I've gone to Apollo. I've gone to various hospitals. The moment you take a 3,000 rupee consultation charge fee, the first thing the doctor does is pulls out his prescription pad. There is no laptop, there is no computer, nothing is entered in these famous hospitals on the digital system. He just puts out a prescription for you. Your only identity in that hospital is a receipt you get for 3,000 rupees you paid. I'm talking about famous hospitals. Where are we? They're in a hurry. AIMS, government's own hospital. I asked the doctors why. The moment I come to you, pull out a prescription pad and you just write a few things, what is my illness, and then you prescribe. I'm not on your system. At least you are on the system in private hospital because you pay the money. The receipt is there. Beyond that, you are nowhere. You are just a receipt. Why can't you change? What does Dr. Philip Augustin do? He's got an assistant sitting there. Whatever you say, it's transcribed onto the computer. And you don't even get a prescription from him. It's sent straight to the pharmacy, and you pick up your prescription pad from there along with the medicine. Simple thing. Why don't we do? Because we don't care. I was chairman of the parliamentary committee of Voluntary Association of MPs for eradication of malaria in the country. We have one of the largest number of malaria patients in the country. I was just reading in the newspaper today, TB patients, we have one of the largest number, and I was very happy to notice today, I think which institute is come out with a kit, it is the newspaper, which just cost $500 for testing TB. I think because we are importing all these kits, I think these are some of the big things we can do. And what does this Rajan and Reggie do? These specialist doctors who are settled down in Tamil Nadu, about whom I'm writing in my book, they went there, lived with the people, they put up a thatched shed, that was a hospital. They're both super specialists. And then they trained girls from the village itself who had passed class A to be the nurses. And he said they're brilliant. And finally, when the winter is, he said, sorry, my thatched shed will not do. I have to reach out to the villagers. He went out to the villagers and he couldn't find anybody who had gone to school. He picked up completely illiterate ladies, trained them for a year and a half, 3 days a week, and he says they turned out to be fantastic health workers. We have far too many doctors in the country. They all want to practice in the city. I only started the private engineering and medical colleges in Kerala from 300 seats in medical colleges. I increased it to 3,000 when I was Principal Secretary of Higher Education. There are only 700 seats in nursing in Kerala. I increased it to 70,000. There are only 3,000 seats for engineering. I increased it to 150,000. Just my decision, no cabinet decision, no minister. I just did it. And the ministry wanted to suspend me. I said, go ahead and do it. Just go ahead and do it. I created 200,000 seats. But one thing I feel so terrible about, many of these medical colleges are taking capitation fee. Whom are we teaching? Whom are we teaching? If you pay capitation fee and get into a medical school, You got to recoup that money because that's an investment which your family has made. Where are you going to work? What's your priority? I think this whole system must change. Everybody, I was also commissioner for entrance examination in Kerala, selecting students to go into the medical school and engineering colleges. I think we should really have people with merit going into any colleges, no capitation fee. We can ensure that. We need to do these things. And the kind of corruption that was happening in the Medical Council of India, sanctioning medical colleges. Once upon a time, a chairman, I don't want to name him, he was worth a few thousand crores. We got to change these things. When we are there in the system, wipe out. I can assure you, when I was district collector, no village officer took 1 rupee. I can assure that. When I was commissioner DDA, I said I will not allow 1 inch of my land to be encroached. I knocked on 14,310 illegal structures belonging to the mafia, carried a gun. Not 1 inch of my land was encroached. We can do it. We have brilliant doctors. We need to respect our doctors. They are amazing people. Indian doctors are great, doing a fantastic job around the world, but we need to refocus. We need to respect our nurses. Our nurses are treated by doctors like chaprasis, like sweepers, isn't it? There is no dignity for the nurses in India. The kind of salary which they are paid by the private hospitals is pathetic. You go abroad. A nurse is the key to the health abroad. Next to the doctor, she's allowed to prescribe medicines, look after, they are respected, and most of them earn close to what a doctor earns. A lot of senior nurses earn $200,000 a year, which is close to what an entry-level doctor earns. We don't respect nurses. You are like a sweeper. I think community needs to respect doctors. Community needs to respect nurses. We need to take this far. India can do it. I was just talking to somebody. The Jan Aushadhi scheme, a doctor was saying, that idea generated in this hall here in the PhD Chamber of Commerce in a discussion. Wow, that is a great thing. Medicines being made available at a reasonable rate to people. I think these are radical changes. But again, I have serious doubts about the quality of medicine that's being sold through medical shops. I think just go to Khan Market and go to the opposite side of that multi-story building. The wholesale fake market is there. Doctor, I don't know what percentage of medicine is fake in India. Nobody knows. The inspector who is supposed to check, he gets his monthly stuff. And how much of medicine we eat is actually genuine and how much is it fake? I really have no idea at all. Absolutely no idea. I think a lot of medicine which I eat, because I'm a diabetic, I also have IBS. These days I go and buy medicine only from branded shops. At least I hope they are like Apollo and a few others which have come up. I have no clue at all what these other medical shops are selling. Is it really medicine? I think we need to change these things. Prescriptions. Yesterday I was talking to a scientist. She's got pimples on her face, and she says she talked to a dermatologist, and she says dermatologist said take antibiotic. I said, please don't. If your doctors are going to prescribe you antibiotic for your pimple, there's something dramatically wrong with that doctor. I think you prescribe too many medicines. I know a doctor in Trivandrum. I was praising all Kerala doctors. This is about 25 years back. Every year he used to get a Mercedes-Benz car from the medical distributors. Every year. Why? Because he's prescribing a certain medicine which needs to be pushed. I think we need to dramatically change this. Government is doing fantastic work. I think the Health Minister, Mansukuchi, is an extremely genuine person. All these reforms in the health sector, wherein we have increased the number of seats in medical colleges and specialities and super specialities over the past 10 years, I think has been a dramatic improvement. So we need many more nurses. But I think the basic attitude has to change, that we are there to make a difference. I decided when I went to Mussoorie Academy, I'm here only to bring happiness on the face of people. Even as a minister, there's not one person whom I haven't met, whoever wanted to meet me. I take my own calls. There's not one call which I have not taken. Why can't we? Isn't it? Yes or no? All this is possible. It's not one message I have not responded to even when I was a minister. I think we all need to imbibe a lot of these things. And I think our doctors are doing an amazing job, but some of them can be a little humbler. Yes, reach out to people, say that we are here for the community. So now, sorry, I already spoke far too much. Now you have the best doctors in the country out here, people who have managed healthcare, who are doing it. Some of them are doing such an amazing job, and of course, they will tell us how do we reach out our medical system to make it a people-centric, a patient-centric system.